hippies don't make money.
Oh,
And that's actually the reason why I went back into medicine.
because you had a child on the way?
I had a child and I had the small holding and I needed to make money. So I knew that I needed to go back into medicine. It was what I was trained to do. And, but a number of things happened quite quickly for me there, because I had been out of medicine for about 6-7 years already. And I'd forgotten a lot of the stuff, of course. And so when I came back into medicine, I started to read up again about drugs and recognize that drugs don't have effects and side effects. I mean, that's the idea that people have, that their drugs have an effect and a side effect. I realized they only have side effects because in a kind of way, they are poisons. If you use enough of it, that you can die, but you're using not enough to kill you, but to give you symptomatic effects.
Yes.
So I thought to myself, no, I can't do that medicine. Remember, I was the hippie, love everyone, into nature, into things like that. And I thought, no, I can't use drugs. I'm going to see, is it possible to treat ill health without drugs?
Oh.
So I became, I guess, the first doctor in South Africa and remained the only doctor in South Africa that was a non-drug doctor.
Is that what you called yourself then? Did you tell anybody, or was this your private definition of yourself? Was that I'm going to be a non-drug?
It was just a
I'm going to see, or at least you're going to experiment.
Yeah.
Can I do this?
The only drugs that I used was penicillin and Panado. Those were the only two drugs that I used in those early days. But
so who wanted you to be that kind of doctor?
Well, that's a good question. My surgery or my clinic was on the highway between Stellenbosch and Franschhoek.
Okay, yes.
It was a farming community, and the only people walking past were the farm workers. So my patients were all farm workers, and they never asked me questions so much about what I was doing.
Just the fact that you were a doctor near enough.
A doctor and somebody who gave time to them. I would listen to them, speak to them, and chat to them. So I became their doctor and their friend in a way. I didn't know much. The only two remedies that I knew about from traveling around was brewer's yeast and kelp. Now, kelp is seaweed and is full of minerals.
Yes.
Brewer's yeast is full of vitamin Bs. And then I was given a diet sheet by some nurse that came past who worked for a naturopath in Cape Town. And it was what she called the cleansing diet sheet. And it was really baked potatoes and boiled onions and some greens.
Wow.
That was the cleansing diet. So I had a cleansing...
Plus brewer's yeast and
kelp.
Kelp.
Yeah.
There's your pharmacology.
Yeah. So that's what I had. And I had the ability to speak to people and no drugs. And to my total astonishment, people with diabetes recovered. Blood pressures came down. All kinds of diseases started to improve. And I thought, what's going on over here? This is not supposed to be happening from such simple little bits of remedies, you see. What I realized after some time was that the reason why they were getting better because they were farm workers and they were eating junk food. And I was putting them onto potatoes and onions and greens and giving them brewer's yeast with vitamin Bs and kelp with all the trace elements in. And of course they were getting better. That's when I realized that lifestyle changes can do more good than any drug on the market. And that's when my practice of medicine really started. And that's when slowly we developed the whole concept of integrative medicine, which is what we started to practice. But the whole point was that what I suddenly realized I was doing was something that had been left out of medicine for a long period of time, and that is medicine had become the treatment of disease. And what I was pointing to, what I realized I was doing, was supporting healthy functions by changing the food choices of the people, by supporting with kelp and brewer's yeast. All that was doing was giving the body the tools that it needed to heal itself. That healing was a natural tendency of the body, and that treating disease was something completely different.
And that only came to you then, that idea that the body actually has the power and the knowledge to heal itself.
Yes. Yeah.
And it's almost as though you had to get so simple with very simple people who wouldn't ask you complex questions about why you're doing this to me, doctor. And very simple resources. And then you could see, well, actually the body is the complex resource. Yeah. That's the pharmacology. There's the real medicine chest is in there.
Because what happened to me later was that things become more and more complex as you learn more and more. Of course. It becomes more and more complex until it becomes so damn complex because you know so much. I mean, that's what happens to all integrative doctors, that they start to learn all this information. It becomes so complicated. And then eventually I came back to simplicity. People can add 10 to 15 years of their life just by changing their lifestyle. Food choices, exercise, stress management, no smoking, and cutting down on your weight. There's no drug on the market that can do that. No. And that's lifestyle. So that's what I learned in those early days. Something really, really simple. The body is so intelligent and so dynamic and so creative that just with a little bit of brewer's yeast and kelp, you can start a whole thing of healing going.
I know you as a teacher and convener of other healers and doctors. How did you get from being this remote roadside ex-hippie doctor with an empty cabinet to starting to teach other doctors and so on?
In the very, very early days, I did an acupuncture course. A doctor sitting next to me, Peter Fraser, he was a homeopath. And he kept saying to me, you don't need needles for doing acupuncture. So I kept saying to him, what do you mean you don't need needles? This is what I've come to learn. So what do you mean I don't need needles? He said, you can use a laser. And I said, a laser? Really? He said, yeah. He said, have you got some time and come and spend a few days with me after this course? And it so happened I did have some time. And I watched him use the laser. Now, a laser is very, very one-pointed, very pure, coherent light. And it just so happened he was going to Europe, and he came back from Europe with a laser for me. For the first 2 years of my acupuncture practice, I never used a needle. I just used the laser light. And to my absolute astonishment, I was starting to see miracles happen. I mean, I can still remember a man coming in with a frozen shoulder that hadn't used his shoulder for a whole year. I remember using this needle, and the needle I used was on his foot. He said to me, can you treat this frozen shoulder? I said, maybe. Let's see what we can do. And I put this needle in to that point on his leg. And I said to him, now, see if you can lift your hand. And I still remember him doing this, you know. And his whole hand went right up. And I couldn't believe it. It was a total miracle to me that one needle in the foot could release a frozen shoulder the man had had for one whole year. I started to see miracles after that with the laser and with the needles. That also changed my thinking completely. I would get people in with back pain walking in like this. And yet they would walk out with the first treatment standing straight up. There was nothing in my training of medicine that could help me understand it. The Chinese spoke about energy fields and meridians and acupuncture points, but that also started to shift my thinking around what's going on over here, because it doesn't fit into physiology. It doesn't fit into anatomy. I mean, they were often points that were totally remote from the place of the problem. I could think that maybe the needles are placebo responses, because people say, oh, it's just a placebo. But the laser, you can't feel anything.
Oh, really?
No, you can't feel anything at all. It's just light.
Well, unless just knowing that the doctor is doing
well,
something to me.
The point is that some people thought with the laser that I was testing something. With light.
So they didn't even think you were.
They never thought that I was giving them a treatment, because I would sometimes not tell them that I was actually going to treat it. And yet their problem disappeared. So it wasn't a placebo response. There was something energetic that was going on.
But I'm interested, you call these miracles. You said, okay, I'm into miracle territory here.
Yes.
What do you mean by miracles in that context?
I guess a miracle is something that was totally unexpected. And coming out of a medical narrative, acupuncture doesn't fit into that narrative at all. There's nothing there that makes sense. And especially with a laser. I think the laser helped me to configure the idea that the human body is not just anatomy and physiology. That's how I got into teaching eventually, because I became chairman of the Medical Acupuncture Society and started to teach acupuncture as well. Acupuncture was somehow the modality that helped me to understand that maybe the Chinese were right. Maybe there is an energy field.
Okay.
The electromagnetic recording of the heart, so-called ECG.
Yes.
You know, the way doctors measure it is putting electrodes on the wrist and on the feet.
Mm-hmm.
Oh, why do they do that? You can pick up the electromagnetic recording of the heart all over the body. That means this complex energetic field is passing through every single cell in the body. But what's even more interesting is that the electromagnetic recording of the heart extends almost 1 meter outside the body.
Okay, now we're into stuff that science
Energy
struggles
meters,
to.
So while we're standing over here,
Yeah.
your electromagnetic heart extends 1 meter and mine extends 1 meter. What does that say about heart-to-heart conversation? So we can have a head conversation and our heart is having another conversation. So we're sharing information constantly.